Yeah, we have become the leading non-governmental provider for clean drinking water. We reach one new person every 10 seconds with clean water.
Access to clean water is a basic human right, yet 703 million people, that's 1 in 10, still lack this essential resource. Women and girls collectively spend 200 million hours every single day carrying water, often walking up to 6 kilometers, which is equivalent to 3.7 miles, to haul 40 pounds of it. The consequences are devastating. Over 1,000 children under the age of 5 die daily from diseases linked to unsafe water, poor sanitation, and hygiene. Addressing a crisis of this scale requires nothing short of a global collective effort. Enter World Vision, the world's leading non-governmental provider of clean water in developing regions. Their impact is staggering. Every 10 seconds, they provide clean water to a new person. At the Concordia Annual Summit in New York City, I sat down with Dr. Greg Allgood, VP of Water and Health at World Vision, to discuss their groundbreaking work. Through their Global WASH business plan, which stands for Water, Sanitation, and Hygiene, they are transforming lives by bringing clean water to the most vulnerable populations. This ambitious plan not only aims to meet the United Nations Sustainable Development Goal 6, ensuring access to clean water and sanitation for all, but also prioritizes reaching the most marginalized communities while building sustainable local solutions. Tune in as we dive into the scale of the water crisis, the innovative solutions World Vision is implementing, and the transformative power of collaboration in tackling one of the greatest challenges of our time. All right. Well, welcome back to the Green Hour. We are sitting here at the Concordia Annual Summit during Climate Week, and I'm sitting here with Greg Allgood, VP of Water and Health for World Vision. Thanks so much for joining us.
Great to be with you.
Yeah. So I think the first question I'll ask you, when I was doing some research, I saw that you went to North Carolina and NC State.
Yeah.
The two rivals. My parents both went to North Carolina State back in the late 80s. So I guess I'd have to ask you, who do you cheer for, NC State or Carolina?
Well, I grew up a NC State fan because my dad was an adjunct professor at NC State working with county agents. And I was there in the glory days of David Thompson and got to see him play.
Right.
But then I was at Carolina when Michael was there. So I have to say I'm Cotarial Blue. But I went to NC State to get my PhD. My NC State friends tell me, well, you had to go to get a degree at State before you could get a job, which I guess is true, technically.
That's awesome. Yeah, my dad played football there. I think late 80s. My mom was a cheerleader. My dad played baseball and football. So we're big State fans. But yeah, I mean, today I just want to kind of give our audience an understanding of what World Vision is and the work that y'all do in water and health. So could you just give us a little information on the organization and the work that you do?
Yeah, sure. A lot of people don't know about World Vision, right, even though we are the largest Christian relief and development organization on the planet. So we work in about 100 countries. We have about 45,000 employees.
Wow.
And the vast majority of them are living and working in the areas where World Vision is providing aid, development, or relief work. We say we have a comprehensive community development model. So comprehensive because we do whatever the community tells us they need help with so they can lift themselves out of extreme poverty. And community because we're typically in rural communities. Now, that may be a very large footprint, typically about 50,000 people in each of the different areas we work in a country. And our staff live and work in those communities. We're typically there for 15 years. So it's a very dedicated approach. And then what we do will depend on what the community needs. But frequently in the rural areas of the developing world that we're working in, people need clean water. They need clean water access. Of course, that usually means they need latrines and a way to handle their sanitation and hand washing hygiene. And then health is a big area. And World Vision has become a global leader in both water and health over the last decade.
Well, I think the global movement right now, if you look at the SDGs, I mean, one of them, I think SDG number 6 is clean water and sanitation for all. So it seems like World Vision is playing a huge role in that around the world.
Yeah, we have become the leading non-governmental provider for clean drinking water. We reach one new person every 10 seconds with clean water, which is hard to wrap your mind around. Every 10 seconds, a new person getting clean water.
Right.
And every person who's reached, their life is transformed forever because development really starts with clean water. If you're walking hours every day to gather water, that's not much of a life. And many times when people are walking for water, they're collecting from dirty sources, water contaminated with bacteria, viruses, and parasites. That's why we have so many cases of dysentery and cholera and typhoid fever. But that all changes when you bring clean water to a community.
Right. Yeah. So you mentioned that you usually go to these rural, smaller communities, let's say around 50,000 people, right, in these communities. And you said that you're there for about 15 years. My question would be, how do you change it? I mean, how do you get to the point of, one person getting drinking water every 10 seconds? Like, how do you go in that 15-year period and completely change the direction of the community?
Yeah. So our work starts with changing mindsets because a lot of times we're having to deal with very broken communities that have been in extreme poverty, maybe for generations. And so helping people understand that they're typically blessed with a lot of abundant resources, things that are there that they can use to help themselves with, and that to deal with the apathy and the mindset change so that people think, hey, we can be successful, we will be successful. And we do that, work with community, build up natural leaders that are there. We put a focus on bringing women into the conversation so they can also have leadership roles in the community. And with that mindset change, then you'll see the bringing in of infrastructure, whether it's digging a well or protecting a spring. And then after that, World Vision does the other things they're so good at, like economic development, organizing people into savings groups, teaching them business skills, providing microloans through our microfinance institution, Vision Fund, and obviously health. So upgrading healthcare facilities so they have clean water and flush toilets and ways to manage their waste, including infectious waste. And all that works together so that people can literally be lifted out of poverty and put on a sustainable path for their lives.
Well, through the research that I did, I came across something that's called the Global Wash Business Plan. Basically a huge business plan to invest, I think, $1 billion over 5 years to extend impact across 41 countries and 6 regions. This is all focused around water. So I think water access, sanitation, and hygiene. Could you talk a little bit about this business plan and the work that's been done since 2021?
Yeah, so the 2021 to 2025 Water, Sanitation, Hygiene Business Plan is our third 5-year business plan. And by doing these 5-year business plans, we've really put a focus on reaching people with clean water, sanitation, hygiene. And it's been remarkably successful. It's helped us be more efficient. It's helped us bring in more innovations and more partnerships and to reach people at this massive scale. So as I mentioned, it's a $1 billion business plan. We're well on our way to finishing the third 5-year business plan. And actually, we started work recently on what's our fourth 5-year business plan.
Oh, wow.
That's going to take us to 2026 to 2030. Because that business plan takes a lot of planning. As you mentioned, it's 41 countries now. It may be a few more in our next business plan. So we work with every one of those countries to tell them we will guarantee you a certain level of financing from World Vision US if you show us that you're going to be able to reach a certain number of people. And importantly for us, the most vulnerable people in the country, the people that need water desperately. That's what's driven the efficiency. We have that agreement, and that's a rare thing in the NGO world to be able to guarantee a source of funding, which guarantees longevity of your staff. It allows them to focus on the mission versus whether they're going to, lose a contract within a year or two. It has been very powerful. We've shown that we can reach a person with clean water, sanitation, hygiene for an average of just $50 a person. That's $50. It's literally going to transform someone's life for forever.
Right. So when talking about funding, I mean, $1 billion, like you said, is a huge amount of money. So, I mean, where does funding come from for World Vision to accomplish a 5-year business plan like this?
Yeah. So we're blessed to have a wide variety of funding sources. So we get government grants. We get grants from groups, intergovernment agencies like UNICEF, UNHCR, a lot of corporations, Procter & Gamble, my old employer that I retired from P&G. When I was at P&G, I developed the partnership with the World Vision, and we're each other's biggest partner. So that's a very strong partnership, but just one of many we have with the private sector. Also, when we talk with our national offices about this 5-year business plan, we have child sponsorship funds. World Vision is the largest child sponsorship organization. And so the national office will say, we're going to use a certain percentage of our child sponsorship funds to provide clean water. And and then we're very blessed to have a large number of high net worth individuals, not only in the U.S., but primarily in the U.S., who have funded us at very high levels. And that's, I think, a distinctive of World Vision to have so many $1 million plus donors. One couple in particular, Dave and Dana Dornsife, they funded our first business plan, our second business plan, our third business plan, and that was at the levels of 35, 40, and then $40 million. So
oh, wow.
Huge investments by them over many years, which shows you how much they believe in the work that World Vision does to consistently provide that much money. And I would say foundations as well. Just like the Dornsifes, the Hilton Foundation, the Conrad N. Hilton Foundation, they fund more water as a foundation than any other organization. And they have funded World Vision longer than anyone else and at higher levels in total, more than any other group they funded. And they fund a lot of groups.
Right. Yeah, to me, it's like being at a place like Concordia and the summit, it's so cool because you talk to people like you that are doing this work globally, to bring water and provide water access, sanitation, hygiene to all these people. And then you can go down the road and basically talk to someone who's working in a completely different continent. But everyone here together is trying to find solutions, trying to work together for the better good of humanity, I would say.
Yeah.
Which is a great thing. But, the stats, I wrote a couple stats down about this 5-year business plan. 15 million people with safe water, I think is what it's going towards. 14 million people with improved sanitation, and then 18 million people with improved hygiene. How do you even get to those numbers? I mean, I'm guessing you forecast, you've got your data from the past 2 business plans, but how do you come up with these large numbers like that?
Well, it's by adding them up in the 41 different countries. So this discussion with each of the national offices, whether it's Kenya or the Philippines or Uganda or Honduras. And so we come up with targets for every country by a 6-month period so we can track our progress, not only our track record of the overall goal, but every 6 months we'll show progress by country. Actually, clean water access is the most important probably, but we have 31 different indicators that we track across to see how we're doing in all the different elements. A lot of the important things are things like behavior change, like are there water committees that are established to take charge of the water point? We work a lot with faith leaders because particularly in the communities that we work with, almost everyone has faith of some type. And so as a faith-based organization ourselves, we feel we know how to work with faith leaders. And so getting them to promote healthy behaviors, storing water safely, building and using a toilet, those are things that congregations will listen to when faith leaders tell them to do it. And we train more than 10,000 every year, faith leaders.
Wow. Yeah, I feel like education in almost every conversation is like the most important thing, right? Just training people, educating them on what's needed, what's necessary. And you said 10,000 people every year.
10,000 faith leaders or more every year. Yeah. The number of people we train is in the millions every year. Yes. And that's based on this community model where we have staff that live and work in these communities and develop a tremendous trust. I worked first for Procter & Gamble, created a not-for-profit water program there, and I had 60 different partners, but none had the level of expertise and the scale that World Vision had and the deep trust in communities. And in the case of P&G, we were introducing a new technology. So having staff that had this built-in trust with communities made all the difference.
Yeah, I talked to, or not talked, but I've read a couple books. One's called, I think, Drive Through Dreams. It's kind of an evaluation of how fast food restaurants in the U.S., migrated into Europe and other places. And it talks about how at first they struggled and they failed because they didn't get into the communities and understand the culture and understand like what people actually ate there, what they liked. And eventually they figured it out. And now you see KFC, McDonald's, and basically everywhere. But it sounds like the same thing here. You're bringing faith leaders in these areas to understand the culture, understand, what's needed, and they're training, and then they're leading different groups of people.
Yeah, faith leaders, community health workers, and our own staff. I mean, our own staff will frequently, be from those communities. So I just came back from Samburu, Kenya, and the staff many were Samburu. Some were Maasai who speak the same language, but they can speak the local language, even the local dialect, so that they can build this trust with communities. And they live there. Now they may commute back to their homes somewhere else every other week, but they live in these communities that they work in.
My next question would be, what kind of infrastructure is needed for these large scale projects? Because I mean, when we're talking about 15 million people with safe water, I mean, you're going into, what was it, 41 countries, I think was the stat. I mean, to me, it's just like, it's kind of mind-boggling to think about the scale of that. So what kind of infrastructure is needed in something like this?
So what World Vision used to be the same approach. So before we started these business plans, these 5-year business plans, about 90% of what we did was to bring in a very expensive drill rig, $500,000 to $1 million, drill a borehole, a deep borehole, and then install a hand pump. Now that's less than 5% of what we do. Okay. That was our target in this third 5-year business plan, and we're overachieving it. So what are we doing if we're not doing as many hand pumps? What we've learned to do is do what will be most sustainable and most cost effective for that specific community. So many times it will be still drilling a borehole with a drilling rig. Sometimes we own it, sometimes we don't. But now more than often we'll put in a submersible pump that's powered by an overhead array of solar panels that pumps the water up into overhead storage tank. It's placed in the highest part in the community, and then water can flow by gravity in many collection points, just not that one hand pump, but in many collection points. So people have even less distance to walk, and we send the water directly into the schools in the community and directly into the health centers, so they have water on premises, which tremendously improves hygiene, which leads to a reduction in the infections that can occur in unhygienic health clinics.
Right. For me, I've grown up in the U.S. I've lived in the U.S. my whole life. Access to water has never been a problem, right? It's always been something I've had and something that's here. So
that's a good point. And most people like that. We take water for granted. It's hard to understand for us that people are still dying from something as simple as the lack of clean water. In fact, there's still 1,000 children that die every day because of diseases caused by unsafe water, whether it's respiratory illnesses or diarrheal illnesses. That's a tremendous toll. It's one of the biggest public health issues. It doesn't get much attention because we sort of become numb to it. It happens every day. And so it doesn't make the news. It's not news because it happens all the time, right? But it's a big tragedy. And perhaps the biggest tragedy is we know how to solve this.
Right.
Kids don't need to be dying from something as simple as the lack of clean water.
Right. Yeah, I feel like sometimes we can become siloed and then kind of unaware about what's happening in the world. But that's why conversations like this are so important, so it can be shared and people can understand that, 1,000 people every day, that's crazy. I mean, it's crazy to wrap your head around that. Yeah. And when there's solutions available, y'all have done the business plans. What number was this? Number 3 that you're on?
This is number 3. So in total, through those 3 5-year business plans, to this point, we've reached more than 28 million people with clean water. So to put that in perspective, that's about the population of Texas, our second most populous state. But we've done it not in a place with good roads and good infrastructure. We've done it in Sudan and the high hills of Honduras and Rwanda and in Asia. So this is an amazing accomplishment to reach that many people. And we've already set our goal for between 2023 and 2030, a new goal, and that's to reach an additional 30 million people with clean water, so that by the time our first business plan, and by 2030, we'll have reached a total of 55 million people with clean water.
Wow. I can only imagine. You talk about transportation right there and how that, there's not always great transportation routes in some of these places. But what are some challenges that y'all faced? I'm sure that nothing's easy, right? Even when you're working in these large scale projects like this. So what are some challenges, setbacks that y'all have faced?
Well, I'll give you a challenge that we faced as part of an accomplishment that we've had. So one of the ideas that we had as we made huge progress towards these business plans and started to see that we were being successful, was we had a breakthrough idea. And it was based on an understanding of why people give and what they give to. And what we found is that NGOs, including World Vision, and lots of groups, ask for money for the same thing, for the same areas, year after year. So we reinforce that the need is never ending, right? So we had an idea. What if we tell people we're going to pick a country and we're going to reach everybody everywhere we work, and when we get the money that we need for that, we're not going to ask for money for those areas for that same thing ever again. We picked Rwanda first, and it was so successful. We gave ourselves 5 years to raise $30 million from U.S. donors. We achieved the funding goal in 3 years. And last year we celebrated reaching 1 million people with clean water, finishing the work in all the 39 sectors in Rwanda where we're working. So that's the success. Where's the challenge in that? So successful, we got to do it again, right?
Right.
So we picked Zambia and Honduras. Rwanda was actually a lot easier for many reasons, one of which was our relationship with the government was fantastic. They funded 40% of the work. They said, your plan is our plan. But it's also the most densely populated country in Africa. So to find where the people were that we needed to reach was pretty simple. You just drove down the roads. Rwanda is also pretty small. It's about the size of Maryland. Zambia is about the size of Texas. And there are extremely remote areas that we work. I've been on many trips there, and you'll ride for hours and hours just getting across the areas we work. So there were no maps showing where people worked. And yet we just promised to reach everybody everywhere we work. We don't know where they are. How are we going to do that? So get this, we use space age technology. We use high resolution satellite images and then artificial intelligence to resolve those high resolution maps down to the level of an individual hut. So now we know the dwellings where people are living. Then we send in our field teams with GPS devices to record where those people are living, what were their water sources. Is it a functional water source? It is a filthy stream. And our team, just in Zambia alone, had to map 20,000 different water points. So now we know where people are. We know where we need to reach people with functional water sources. So now we can fulfill our promise of reaching everybody everywhere we work in Zambia. It's going to be 1 million people as well, but a much more difficult task. We're well on our way. We've reached about 2/3 of the people we need to reach by 2026.
Well, I guess in that sense, I mean, it was a challenge, but now it's kind of like a case study you can use for these places in the future.
This has never been done in the water, sanitation, hygiene sector. So of course we're sharing it with other people so they can replicate our work. And we're already seeing that in Rwanda. Other groups are starting to promise to finish the job in the areas that we're working. USAID wants to help fund that. They've funded some other organizations like CARE to finish the work in their areas. And the Rwanda government is getting behind it as well.
Wow. Well, I think the final question I'll ask, for all of our listeners out there, could be in basically any continent except for Antarctica. But, if they want to get involved with World Vision, if they want to, help in any way they can, where should they go to help in any way?
Yeah. So worldvision.org, our U.S. site is a great place to learn more about our work. It'll say what we do, and you can click on water or health or many of the economic development, other areas of work in. As I mentioned, $50 provides clean water that changes a life forever. But we also have other price points people can invest in. If they're interested in a higher price point, for example, for $15,000, people can fund a well. They'll get a report for the specific place, the specific community with GPS coordinates of that water point that they funded and the number of people that have been served with a water point.
Well, that just made me think of something, and I could be completely off track here, but in sustainability, we work a lot with offsets, like carbon offsets and even water offsets. Do corporations come to y'all for water offsets in any sense?
We have not yet done that, but we have some discussions underway to do water offsets and also carbon offsets, because when people have clean water access, they're not, if they don't have it, they're typically burning firewood to boil water so that the water's safe. And so there's also a huge positive environmental impact. We also do a lot of farm managed natural regeneration, which is a system that a World Vision Australia staff member has resurrected to help regrow forests that are already there. And we also do a lot of protecting of watersheds. And we've seen amazing increases in the microclimate water that's available because of this work. So when you fund water work with World Vision, you're also doing something that's environmentally safe.
Wow. Well, Greg, we can't thank you enough for joining us today.
Great. Thank you.